Hello, everyone, and welcome to our question lab. This evening's theme is neuroanatomy, and leading our dissection once again today is Dr. Paras Vakarian, and he's going to introduce himself now.
Hey guys, thank you, Sean. My name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. And now working with USMLE-Rx as an RX coach. So working one-on-one with students to help prepare them for the USMLE Step 1 and then also Step 2 CK, and am happy to help lead tonight's session.
After we cover up the answer choices, we will read the lead-in. The lead-in is the last sentence of the question itself. So here we go. This patient most likely experiences weakness in which movement? This patient most likely experiences weakness in which movement? And after we do that, we'd like to ask our students how many steps they think this question will require. The reason we do that is because we want you to have an organized thought process so you don't forget any steps on test day and make sure that you answer the right question. We read the lead-in first because we want you to know what the question is asking, so when you're reading the vignette, you know which clues to look out for, and hopefully that will prevent you from having to reread the question and waste time on test day. So now that we've read the lead-in and you guys have been responding and letting us know how many questions you think it will require, let's go ahead and read the vignette. A 35-year-old sanitation worker with no significant medical history presents to the clinic with a report of severe lower back pain that began suddenly as he was lifting a heavy load. He describes the pain as sharp and radiating down his left leg and foot. He denies any bowel or urinary incontinence. The pain is reproduced when the physician lifts the patient's left leg, above the table at a 30-degree angle. Ankle jerk reflex testing reveals 1+ on the left side and 2+ on the right side. Sensation to pinprick is diminished markedly on the lateral portion of his left foot. This patient most likely experiences weakness in which movement? We'll give all of you a second here to start thinking about what the important clues are in this vignette as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to kind of walk you through what we think are the important clues in this vignette and the lead-in. Okay, so let's start with this vignette. We have a 35-year-old patient. Anytime you have demographics, that's really going to start to clue you in on what you should be thinking, what you can maybe push a little bit down on your differential. They also give us some social history, what he does for work, and that's really one of the first things they give you. So that's usually kind of important when they're telling you that right off the back that he's a sanitation worker. And then you can see that developed some back pain after doing some lifting that is probably related to that sanitation work, okay? Then they give us some important physical exam findings. We'll kind of talk about the significance of that later, but interpreting those physical exam findings and the differences on the right and left, they also gave us some negative findings of no bowel or urinary incontinence, and there are some things that should be going through your mind when you see that, if it were to be positive. So these are all important neurologic exam findings that it's important to take note of and try to piece together. So now let's move on to that lead-in, and they're basically asking us, the patient would have a weakness in which movement, okay? So they're probably going to give us some answer choices that are different movements, and we're going to have to figure out which one is this patient going to have some difficulty with. So how many steps is this question? Well, I think, at least 2. I think 1, we need to figure out what's going on with this patient, where's the issue going on here, what's the diagnosis, and then based off that, what else could this patient have issue with? So probably a 2-step question here, but let's take a look at those answer choices. And as you can see there, we have 5 answer choices. And what I'm going to do is I'm going to go through them, and I'm going to actually start at the bottom, answer choice E, and work my way up to the top with answer choice A, okay? And the reason we like to do this and recommend that students do this is because this ensures that you get through all of the answer choices. A lot of times we'll see students that will start at the top, they'll work their way down, they see something they like, and they select it without having gone through all the answer choices. And then they actually end up getting the question incorrect. So this way it ensures that you get through all the answer choices and are not biasing yourself. So I'm going to go ahead and do that now. Answer choice E, toe extension. D, plantar flexion of foot. C, knee extension. B, hip flexion. And A, dorsiflexion of foot. So we're going to go ahead and open up that poll. Go ahead and select the movement that you think this patient also may have weakness with, and we will talk about it in just a few seconds.
Excellent. Thank you, Para. So we'll give all of you a few seconds here to submit your responses. Keep in mind that all of the responses are anonymous. There is no penalty for guessing on test day, right? You never want to leave a question blank, and certainly not tonight. So if you are struggling with what you believe the answer is, or you're not sure, don't worry. Take your best guess, and then we will talk about why the right answer is right and why the incorrect answers are incorrect. I see the responses coming in. We'll give all of you a few more seconds. Once again, if this is your first time joining us, please let us know in the question box. All right, let's see what you selected. And it looks like 38% of you selected dorsiflexion of foot and 31% of you selected plantar flexion of foot. So let's take a look and see what the correct answer is. And the correct answer is D, plantar flexion of foot. And 31% of you got it right. If you got it right, congratulations. But let's make sure you got it right for the right reasons. If you didn't get it right, don't worry. It's a learning process. You'll get it right on test day if you listen to Boris now.
Thank you, Sean. Great job, guys. Definitely a good question here. So what is this patient presenting with? Well, probably had something happen after lifting that heavy load, okay? And this is what you would call lumbar radiculopathy. And it's probably a herniated disc that we're dealing with in the lumbar region, okay? Patients with herniated discs often experience back pain that radiates into the lower extremity, which is what we have here, okay? And then this patient also is having a positive straight leg raise test. So what is the straight leg raise test? It's when the physician raises the patient's leg at an angle, usually about at least 30 degrees off the table, and they can reproduce or elicit that pain again, okay? It's a pretty sensitive test for picking up disc herniation anywhere along the L4 to L5 or L5 to S1 levels. So actually on the next slide, Sean has actually gone ahead and pulled up a table and figure looking at common lumbosacral disc level herniations. So this patient likely has an S1 nerve root or radiculopathy, okay? And that's usually because of a herniation of L5-S1. Patients with this will have decreased sensation of the posterior leg and the lateral foot. And remember, our patient had that lateral foot issues. They'll also have a diminished Achilles reflex, as you can see there in the clinical findings at the bottom. And then also, you can see there that there is weakness of plantar flexion. So that's why answer choice D was the best answer, because this patient can also have weakness of plantar flexion, okay? Now, if you take a look at an L5 herniation, you can see that in that situation, a patient may have weakness of dorsiflexion, but we've determined that this patient probably had an S1 herniation, so that would be an incorrect choice. And then with an L4 disc herniation, you could have a weakness of knee extension, which was one of the answer choices. But again, we've determined that this patient likely had an S1 herniation because of those symptoms and that decreased Achilles reflex and the lateral foot symptoms as well. Okay, and if you look there at that diagram of the spinal cord, you can see there that L5-S1 disc protrusion, that second red box. You can see how that's actually impinging on that S1 nerve root and how that leads to compression and symptoms or radiculopathy of that S1 nerve root, okay? So now let's go back to our vignette and our other answer choices. So hopefully you see now why D is the best answer here. We talked about answer choice C and how that would be related to a better answer would be L4, and we talked about how dorsiflexion of the foot would be caused by L5 radiculopathy. So just to cover the other answer choices, answer choice E, toe extension. This is also something you would get with an L5 radiculopathy. It would also have, as we mentioned, weakness of dorsiflexion and toe extension. So not what we have with our patient. Ours is S1. And then lastly, answer choice B, hip flexion. This could be a few things. This could be any nerve from L2 to L3 to L4. Okay. But again, we've already determined those are a little higher up than what we have with our patient. So the best answer here is first for figuring out that this is an S1 radiculopathy, and then based off that, knowing that the patient may also have weakness in plantar flexion.
Excellent. Thank you, Paras. Great job, everybody. Once again, that was a challenging question. So let's move on to question number 2. Once again, the answer choices are covered up. That is by design, and we will begin with the lead-in. Damage to the brain in which of the following arterial distributions is most likely responsible for the patient's findings? I'll give all of you a few seconds here to let us know in the question box how many steps you think this question will require. I see some of our veterans answering. Let's go ahead and read that vignette. A 55-year-old man with a history of diabetes, hypertension, and atrial fibrillation presents with a newly diagnosed aphasia. His word repetition ability and language comprehension are both impaired, but his fluency is preserved. Damage to the brain in which of the following arterial distributions is most likely responsible for this patient's findings? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So once again, we're going to show you what we think are the important clues in the vignette and the lead-in. We obviously have a much shorter question here. So there's going to be some important things. Each word is going to be very important to analyze, okay? So let's take a look again at that vignette, and we're going to show you what we think are the important clues. So again, demographics, 55-year-old man, and then they give us some past medical history right off the bat, so probably going to be important. And then they tell us he's got aphasia, and then they get into more specifics, and they're probably trying to get us to figure out what kind of aphasia based off those things, okay? So then they ask us in the lead-in, specifically, damage to what arterial distribution is likely based on those findings, okay? So we're gonna have to figure out a few things. So how many steps is this question? Well, 1, we need to figure out what's going on with this patient. 2, what arterial, or I guess based off what's going on with this patient, what lesion, what area may be affected. That's probably step 2. And then 3, the third step is probably what is the arterial distribution or arterial supply to that lesion or area. So probably a nice 3-step question here. So let's take a look at those answer choices and see what we're working with. Answer choice E, superior division of the middle cerebral artery. D, lenticulostriate branches of the middle cerebral artery. C, left posterior cerebral artery. B, inferior division of the middle cerebral artery. And A, arcuate fasciculus. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we will talk about it in just a few seconds.
Excellent. Thank you, Paras. So once again, you see the poll. Remember that all the choices are anonymous. Select the best answer, and then we'll talk about all of the answer choices like we always do. Keep in mind that when you're doing questions on your own, it is important to review all of the explanations so that you know why the correct answer is the correct answer and why the incorrect choices are incorrect. And later on, we'll talk briefly about our new explanation format within our question bank, which we're very excited about, and I think you will be also. I'll give all of you a few more seconds here. Looks like we might have a tie. right, and let's see what all of you selected. It was close. So 33% of you selected inferior division of the MCA and 30% of you selected superior division of the MCA. So let's take a look and see what the correct answer is. And the correct answer is B, inferior division of the MCA or middle cerebral artery. And with that, I'll hand it off to Paris.
Thank you, Sean. So definitely a tough question. As you can see, this is a good 30-step question that required a lot of pieces. So this patient is presenting probably with a stroke, and we have a few different potential etiologies: diabetes, hypertension, atrial fibrillation. That's probably why they told us that right off the bat. So this patient has issues with language comprehension and also language input and output. However, the speech is still fluent, or fluency is preserved, okay? Thus, this is likely Wernicke's aphasia. Once again, Wernicke's aphasia, okay? On the next slide, we've actually gone ahead and pulled up the table in first aid that talks about different aphasias. And you can see there that with Wernicke's aphasia or receptive aphasia, you have issues with impaired language comprehension, okay? And that's what this patient has. So with Wernicke's aphasia, okay, where could this potentially be the issue? So the lesion is in Wernicke's area, and this is most likely caused by a stroke in the part of the middle cerebral artery. And on the next slide as well, we have another table that shows some of those cerebral artery distributions. And you can see there under the middle cerebral artery, you can see there that it supplies Wernicke's area, okay, in the temporal lobe, okay? So that's how you know that it would be the middle cerebral artery that would be affected in Wernicke's area or Wernicke's aphasia, okay? So the best answer choice here, going back to our question and answer choices, would be answer choice B, the middle cerebral artery, specifically the inferior division, okay? Now let's take a look at the other answer choices and why those are less correct answers. Answer choice E, this would most likely be getting at something causing Broca's aphasia or a lesion in Broca's areas, okay? And this is more of the superior aspect of the middle cerebral artery based on where it's affecting in the brain. So Broca's aphasia is also characterized by preserved comprehension, but not able to produce language, which is different than what our patient has. Answer choice D, lenticulostriate branches of the MCA. This usually affects more of your internal stuff like the internal capsule, the basal ganglia, the pons. So you're more likely to have motor and sensory issues rather than aphasia. Answer choice C, left posterior cerebral artery. This would be causing more of sensory issues, so like a transcortical sensory aphasia, which is different than what we have here in this patient. And then lastly, arcuate fasciculus. A stroke in this would result in conduction aphasia. Remember, this is kind of that link between the two areas. And with this, you have issues with repeating what is said, but your comprehension and fluency are preserved. We know our patient's comprehension is impaired, so a lesion in the arcuate fasciculus is not as good of an answer choice. So answer choice B would be the best answer choice of these answer choices.
Excellent. Thank you, Paris. Great job, everyone. That was a challenging question, but many of you are on the right track. Now, we mentioned RX Coach earlier, and I want to talk briefly about it. You've met some of our RX coaches. You met Paris, you met Alec. We have a wonderful team of coaches, and what we do is we work with you on a one-on-one basis to help you succeed on your academic journey, be it for medical school exams, for USMLE, for COMLEX, for Step 2, Step 1, CBSE exams, comprehensive exams, all of those things. And the reason why we've been so successful is, there's many reasons, but I think one of them is the fact that, we are the only tutoring company, or one of the only tutoring companies, that actually was in medical education prior to starting tutoring, right? Our founders created First Aid, USMLE-Rx, RX Bricks, our question bank, flash facts, express videos. So with all of that experience and that breadth of knowledge comes a lot of data, and we're able to take a data-driven approach to help focus your study and make it more efficient. Students regularly tell us that after coming to RX Coach and subscribing to our services, they've been able to accomplish their goals much faster. So we'll take the guesswork out of studying. So the first thing we'll do is, if you're in school still, we'll look at your syllabus. If you're in dedicated or close to step studying, we'll administer an assessment exam that we created. And then we'll look at the data there to come up with a personalized study plan, and then work with you at regular intervals to implement that study plan, work on knowledge and content, work on test taking skills, and then closer to test day, we'll work on timing and stamina as well. So if you're interested in learning more about working with an RX coach, please visit us online at rx-coach.com. That's rx-coach.com. You can click on the free consultation tab to have a consultation with me to talk about RX Coach and how it can benefit you. And as always, if you're interested in some general study advice or our free study planner, which Jeff will talk about later, you can visit us at firstaidteam.com. So once again, the website is rx-coach.com. And as you can see, we have 4.9 out of 5 for student satisfaction. That's a great testament to the wonderful work all of our tutors are doing. So with that, let's go ahead and move on to our third question of the evening. Once again, you see the answer choices are covered up, and we will begin with the lead-in. Which of the following best describes a normal function of this brain region? Which of the following best describes a normal function of this brain region? We'll give all of you a few moments here to let us know how many steps you believe this question will require, and we'll read the lead-in. All right, I see the responses coming in. Let's read the vignette. A 70-year-old woman presents with a 2-day history of sudden onset involuntary large movements of her right arm. The patient was cooking dinner when suddenly she dropped her soup on the floor. The patient has a history of hypertension and diabetes mellitus, and she has been non-compliant with her medications for the past 5 years. She drinks alcohol on social occasions and denies a history of smoking. 3 close relatives also suffer from diabetes, and her father died from a stroke. A CT scan shows an infarction of a specific region of the brain. Which of the following best describes a normal function of this brain region? I'll let all of you start thinking about the important clues in the vignette and lead in as I hand it off to Boris.
Thank you, Sean. So once again, we will go ahead and show you what we think are the important clues in this vignette and the lead-in. Again, they tell us this is a 70-year-old woman, so demographics always important. Then they also give us some signs and symptoms of what's happening to her. It's also important to take note of the temporal relationship. So we know this is 2-day history, okay? They give us more medical history, and then they tell us whether she's been compliant or not. So they're probably getting at something there. Anytime they give you that added information, always, be curious as to why they're telling you that. They give us some family history, and then they give us some imaging results as well, showing an infarct of a brain region. So, how many steps is this question? Well, I think it kind of depends on how you would look at this question. But I think one, we need to figure out, what's going on in this patient, and that, depending on how you look at it, since we already know there's a region of the brain that has an infarct, you could say, well, number one is what is that brain region affected? And then 2, based off that, what is the normal function of this brain region? So I think that's a fair thing to do, is to say this is a 2-step question. You could also say that 1, figure out what's the issue, 2, what's the specific region of the brain affected in this problem, and then 3, what's the normal function of this brain region? So maybe a 2 to 3 step question here. So let's take a look at those answer choices. And once again, we have 5 answer choices, and I'm going to start at the bottom and work our way up to the top. Answer choice E, inhibition of the motor cortex. D, inhibition of the internal segment of the globus pallidus. C, excitation of the thalamus. B, excitation of the motor cortex. And A, excitation of the internal segment of the globus pallidus. So once again, we're going to go ahead and open up that answer choice. Go ahead and select the one that you think best describes the normal function of this brain region. And we'll talk about it in just a few seconds.
Excellent. Thank you so much, Paris. Once again, we have opened up the poll. We'll give all of you a few seconds, and we'll wait until about 2/3 of you have responded. As always, we do have a raffle and a special offer for all of you in attendance, so make sure you stick around because you must be present to win. Next week's topic, for those of you interested in joining us, will be endocrine pharmacology. All right, I see the responses coming in. We'll give all of you a few more seconds here. All right, and let's take a look and see what all of you selected. And it looks like 36% of you selected inhibition of the internal segment of the globus pallidus. And in second place was excitation of the motor cortex. Let's see what the correct answer is. And the correct answer is A, excitation of the internal segment of the globus pallidus. And 17% of you got it right. A challenging question indeed, but don't worry, Boris is going to explain it to you.
Thank you, Sean. Yeah, definitely a tough question. And this specific topic in neuroanatomy is always tough to wrap your head around. So let's see if we can do that today. So this patient has sudden, large, involuntary movement of the right arm, okay? We also know she has hypertension and diabetes, which she's not been compliant with her medication. So those are probably very active. So we really should be thinking about some of those small vessel strokes or lacunar strokes or lacunar infarcts. So now that we've determined that this patient likely had that type of stroke, where in what specific region of the brain? Well, I think we need to look at that large involuntary movements and pick up that this is what we would call hemibolismus, okay? And with hemibolismus, you should really be thinking about specific areas of the brain. And on the next slide, we actually have gone ahead and shown that with certain movement disorders, what you should be thinking about. Hemibolismus is sudden wild flailing of one side of the body. And the lesion is the contralateral subthalamic nucleus, or STN. Okay, so the contralateral subthalamic nucleus. So that's where this infarct likely happened. So let's take a look at the next slide. And here is that nice, lovely image of all the arrows, all the inhibitory and excitatory arrows in the basal ganglia. But it's important to know, and it's important to know the role of the subthalamic nucleus. You can see there that it's that kind of green ovoid nucleus with STN in it, okay, in that picture on the left. And you can see there that the subthalamic nucleus has a stimulatory pathway or arrow pointing to the GPI, which is the internal segment of the globus pallidus, okay? So the subthalamic nucleus directly stimulates the internal segment of the globus pallidus, which is why answer choice A was the best answer. Now, by stimulating the the internal segment of the globus pallidus, that goes and inhibits the thalamus, okay? And when you inhibit the thalamus, you're inhibiting kind of movement and motor function. So you can see how if you had a stroke in the subthalamic nucleus, you would lose that excitation or activation of the GPI, and thus you would lose the GPI's inhibition or inhibitory effect on the thalamus. And now the thalamus is free to do all this excitation of the motor cortex, and that's how you get this wild flailing of the contralateral side of your body, and that's called hemibolismus, okay? So hopefully kind of walking through it with you today helped explain that. And now we can go take a look again at our vignette and the other answer choices, and you can see how excitation of the internal segment of the globus pallidus is the best answer, okay? Now let's take a look at the other answer choices that some of you guys selected. Answer choice E, inhibition of the motor cortex. Well, activation of the subthalamic nucleus does eventually lead to inhibition of the motor cortex. We did talk about that, but it's a downstream effect first it excites the globus pallidus, okay? And then you have the effect on the thalamus, and then you have the effect on the motor cortex. So answer choice E is correct, but it's downstream, and answer choice A comes first, okay? So that's why it's important when you're looking at that lead-in, it's asking you which best describes a function of this brain region. So you need to pick the best answer here, okay? Answer choice D, inhibition of the internal segment of the globus pallidus. We actually just talked about how it excites that, so that we know is incorrect. Answer choice C, excitation of the thalamus. We just talked about how the subthalamus nucleus excites the globus pallidus to then inhibit the thalamus, so we know answer choice E is incorrect. Sorry, C is incorrect. And then lastly, answer choice B. We already know that the subthalamic nucleus eventually leads to inhibition of the motor cortex, so answer choice B is also incorrect. So a very important pathway, but it's important to know, and hopefully walking through this question helped you understand it just a little bit more.
Excellent. Thank you so much, Paris. Definitely a challenging question. Neuroanatomy tends to be one of those topics, but you know, if you get questions wrong, especially challenging ones, you know, don't lose hope, right? This is a learning process. You're here to learn so you'll get it right on test day. So it was a challenging question, but great job. And hopefully now all of you will get it right on test day. So let's try to finish strong with our last question of the evening. We'll begin with the lead-in as always. Which of the following is most likely occluded to cause this patient's disease? We'll give all of you a few seconds here to let us know in the question box how many steps you think this question will require as we begin to read the lead-in. A 74-year-old woman is brought to the emergency department by her granddaughter due to weakness and a funny feeling in her right arm and leg. The patient was at home with her family when symptoms began. She has a long history of smoking. On physical examination, she demonstrates paralysis and loss of vibratory sensation and proprioception on the right side, whereas pinprick and temperature sensation are intact. Reflexes are 4+ in the affected areas. She does not have facial weakness, but upon protrusion, her tongue deviates to the left. Which of the following is most likely occluded to cause this patient's disease? Please start thinking about the important clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So once again, we will go ahead and show you what we think are the important clues in the vignette and the lead-in. And the reason we're doing this is hopefully you guys can start to pick up on you know, some of our experience in knowing what's important in vignettes, you know, what's not as important to not highlight. So when you need to go back to that question and vignette, you've highlighted the relevant stuff, and you can kind of skip the not as relevant stuff, okay? So hopefully this practice and doing it in 4 questions, seeing what we've highlighted has helped you a little bit today as well. So again, demographic, 74-year-old woman. We know she's got some more symptoms along the lines of neuro. And then they give us those physical exam findings. And as I'm sure you guys probably have picked up on, we're gonna have to combine all those and try to come up with a diagnosis of sorts based on those constellation of signs and symptoms. So let's look at that lead-in. They're asking us what was most likely occluded to cause this patient's disease. So I think this is probably a nice 2-step question. I think 1, we need to figure out what is that patient's disease. And then 2, what would have been occluded, most likely occluded, to cause that disease? So probably a nice 2-step question here. Let's take a look at our answer choices and see what we're working with. So answer choice E, left posterior inferior cerebellar artery. D, left middle cerebral artery. C, left anterior inferior cerebellar artery. B, left anterior cerebral artery. And A, anterior spinal artery. So we have a lot of arteries there that we need to wrap our head around. So we're going to go ahead and open up that poll, and then go ahead and select the one you think was most likely occluded in this patient.
Excellent. Thank you, Paris. This is our last question of the evening, so let's try to finish strong And then we will have our raffle and a very special offer, and Jeff will share some interesting new things with you. I want to congratulate everybody on Match Week. If you matched, congratulations. Please let us know in the question box. We'd love to hear from you. All right, I see the responses coming in. We'll give all of you a few more seconds. And once again, we do want to congratulate our RX coach, Alec, for matching into ortho. So congratulations to Alec. Well done. All right, let's see what you selected. And it looks like 29% of you selected the left posterior inferior cerebellar artery. And let's see what the correct answer is. And the correct answer is B, anterior spinal artery, which I think is was actually answer choice A, anterior spinal artery. And looks like 20% of you got that correct. So well done to those of you who got it. If you didn't, don't worry, just pay attention to Paris now.
Thank you, Sean. Yeah, sorry, this was actually answer choice A, anterior spinal artery, okay? So what's going on with this patient? Well, this patient is having some important things, some important physical findings. And I think the one that really sticks out to me is that tongue deviation to the left, okay? So obviously this patient has some signs and symptoms that are concerning for a stroke. But that first clue that really helps you out is that tongue deviation. And that should kind of be pointing you towards medial medullary syndrome, okay? An infarct of the medial medulla also can cause contralateral weakness in an upper motor neuron pattern, okay? And which is what we see this patient has, hyperreflexia on the arm and leg. You can also have loss of proprioception and vibratory sensation below the neck, okay? And this is usually caused by occlusion of the anterior spinal artery, okay? So let's take a look at that nice stroke table in first aid. It's on the next slide. And actually, first up, I think, is just the circulation. And this is kind of a good review to make sure you know the different circulations, ACA, MCA, PCA, and then you can see there at the very bottom, the anterior spinal artery, okay? Now let's go to the next slide, and you can see here the effect of a stroke involving the anterior spinal artery. And you can see there in the first column, caudal medulla can lead to hypoglossal nerve involvement, okay? Which can lead to ipsilateral hypoglossal dysfunction where the tongue deviates to that side. You can see there are also some other signs and symptoms of losing contralateral proprioception as well as paralysis, okay? And this is also known as medial medullary syndrome, okay? So hopefully you guys picked up that this tongue issue is really what should point you into cranial nerve 12 or hypoglossal nerve, which is often affected in strokes involving the anterior spinal artery. But let's go back to our patient and the vignette and the answer choices, and just review some of the other ones because this is a very high yield topic. So answer choice E, the left pica or P, posterior inferior cerebellar artery. This artery supplies the lateral medulla, and occlusion produces the symptoms of what we call lateral medullary syndrome, what used to be called Wallenberg syndrome. So ataxia, vertigo, importantly, dysphagia, okay, that kind of helps separate it from ICA syndrome. And then loss of pain and temperature to the ipsilateral face, contralateral body, and you can also have a ipsilateral Horner syndrome, okay? We are not having those signs and symptoms in this patient, so that is unlikely to be the best answer choice. Answer choice D, MCA. This supplies the lateral aspects of the cerebral cortex. So if you were to have an occlusion of the MCA, you would have weakness and complete sensory loss in the contralateral upper extremity and face, while sparing the lower extremity. So this would only explain half of the patient's signs and symptoms, not all of it. Answer choice C, ICA. This supplies a few things, and this can result in what we refer to as lateral pontine syndrome, okay? The most specific clinical sign is paralysis of the ipsilateral face, and we don't have that in this patient, okay? You can also get some other important sensory defects as well, decreased taste as well, okay? But we are not seeing that. We're also not seeing issues with vertigo, nystagmus, ataxia, so things that are pointing against ICA as well. And then lastly, answer choice B, the ACA, the left ACA, that supplies the anterior medial surface of the brain. So if you were to have occlusion of this, you would have weakness and complete sensory loss limited to the right side of the body, which is consistent with some of the patient's deficits. However, the upper extremity would be spared because that's supplied by the middle cerebral artery, okay? So that's also not the best answer choice. So the best answer choice here is anterior spinal artery, and that's picked up by picking up on that tongue clue. So hopefully going through these questions on neuroanatomy helped you guys a little bit today, and hopefully our question dissection helped you out as well. And I will hand it back to you, Sean.
Thank you, Paris. Great job as always. Great job, everybody. You know, this was a challenging topic. We had some really challenging questions, but you guys did a very, very great job, and hopefully you learned a lot from it. I do want to share with you one of our bricks, and this is in line with our theme today of neuroanatomy. This is anatomy of the spinal cord. So if you're not familiar with bricks, I highly encourage you to check it out. I'll give you a brief overview now. Each brick, these are learning modules, and unlike textbooks, it's very conversational, so it's not formal text like that, right? They all begin with learning objectives. So after completing this section, you will be able to do these following 4 things, hopefully, right? We have a case connection. We start talking about the content. What is a spinal cord? How is it organized? And we have these nice interactive images, and as you can see here, you can quiz yourself. You can hit this quiz button and the labels will disappear, and you can go in there and see if you can identify what these items are. Tables, you have flashcards here. Another interactive image, and once again, you hit the quiz button. You can try to see if you can identify these on your own. And that is a relatively new feature, and we're really excited about it. Clinical correlations here, as you can see. Another image, another flashcard. And as you keep going and through this learning module, you will learn more and more, and eventually you will get to the end. And so we have the case connection. Going back to the case connection we presented earlier in the module, a summary of the take-home points from this brick. We have practice questions, so you can practice, and once you get the correct answer, you will get an explanation of that question and the answer choices. You know, a lot of medical students struggle with how many resources they have and how to organize them, right? Well, this will help you stay organized because A, you can review your learning objectives and mark off what you're confident with. And if you want to go deeper, you can go directly into first aid. As you can see, First Aid 2021 has been uploaded here. You can go directly into first aid. You can study with flashbacks, which employs a spaced repetition, which is a very valuable learning tool. You can watch express videos if you want to learn more, or you can practice with our question bank and practice these questions within QMax. So for those of you who haven't taken a look at bricks, you know, I really encourage you to sign up for the free trial. Even when the free trial expires, you'll still have access to about 150 free bricks. So definitely check it out if you haven't already.